Hey everybody, and welcome back to my channel. Today we are talking all about MCAs, and let's get right to it. So I don't know about you, but I haven't been able to visit a POTS forum or a support group or like a research page on the internet without coming across MCAs, and so it kind of felt like I needed to do my own research on what MCAs was. You know, it had been suggested even to me on YouTube here on my channel that maybe I was dealing with MCAs at one point. And so I really wanted to do my own research, like I said, dive deeper and just find out what is MCAs, what does it mean, and then potentially, find maybe a link between MCAs and POTS, as like I said, I see a lot of people with POTS who also are dealing with MCAs. So let's get into it. MCAs, which you probably already know, stands for mast cell activation syndrome. And mast cells are the cells in our bodies that tend to cause us trouble if we have an allergic reaction to something. So for example, if I eat a strawberry and I'm allergic to strawberries, which I'm not, but just an example, if I eat that strawberry and my body is allergic to it, my mast cells are going to react and they're going to release different chemicals in the body, and the most commonly known one is histamine, but they also release other chemicals besides just histamine. And you can have a reaction that's topical, so like your skin, you might get a rash or hives and be really itchy, or it may affect your nose and you get a stuffy nose, things like that. But something else that these cells release is called tryptase. And actually, scientists don't really know exactly what it's supposed to do in the body, but unlike histamine, it actually lasts quite a while in your blood. So because of this, it can be pretty valuable because they can use that in a test, a serum blood test, to test your tryptase levels, and that will give you a good indication and more data on what type of reaction you had. Sorry, my son came in for a second there. He brought me a fizzy water. He knows mommy loves fizzy water, so he brought me one, which was sweet. But anyways, I was saying that because tryptase stays in the body longer, and actually about 4 hours, you're able to get, your blood serum tryptase test done so that you can see what type of allergic reaction you were having. And so, for example, if I had that strawberry that I was allergic to, I could then get my tryptase tests levels tested. So something interesting that I found out in my research is that some people just walk around day to day with a high tryptase level, what doctors consider high. They're not even really sure, but they've kind of cut it off and had a baseline, and based on what they've deemed high, a lot of people walk around with a high tryptase. And so for those people, they have all these mast cells that are overactive, and too many of these cells, and they're releasing chemicals, but not because they are having an allergic reaction or have come into contact with something that their body's allergic to, but it's just doing it all the time. So these people again are experiencing flushing, itching, abdominal pain and cramping, and some people even just flat out pass out. So many doctors, when they see these types of symptoms in a patient and they have a high tryptase blood serum level, they automatically want to test for something called mastocytosis. And this is a more severe mast cell disorder, and it's when a person has far too many mast cells in abundance in their body and they're firing off, and it's actually in their bone marrow, and it's causing all sorts of awful symptoms for the person. And I've even heard it being compared to types of cancer, this mastocytosis. Now, it's not cancer, but the way that they explained it with all these cells and the way that they're behaving in the body, they kind of likened it to cancer in some ways. And it's definitely something that needs to be addressed and diagnosed. So the doctors will see the patients with this high tryptase level, they'll see all these symptoms, and they'll want to check for it. But what ends up happening a lot of the time is, while they have all these symptoms and the high tryptase, their bone marrow tests come back completely clean, and they don't have mastocytosis. So what then are they experiencing? And this is where doctors come in saying that, okay, you have MCAs or mast cell activation. And not a lot is known about mast cell activation at this point. There's not a lot of data and there's not a lot of research. There is a lot of information on the internet and in textbooks about MCAs, but there's not a lot of studies and actual research to gain more knowledge about exactly what's going on in a person's body and what's causing this. So because there's not a lot of data and research, doctors just try to do their best and piece things together based on, your blood serum tryptase, your symptoms that you're experiencing. They've ruled out mastocytosis, and they just, you're labeled with this MCA's mast cell activation syndrome. And so another thing to mention is that there's been a recent study, I believe it was in 2015, so within the last 5 years or so, where all the families, all the patients that were being followed and studied for this research study, 100% of the time, there was an inheritance of the MCAs. There was a specific gene that was passed down to this person. So in 100% of these cases, there was a first degree relative that also had high tryptase and MCAs firing off in their body, maybe to different degrees. Some might have it severely. Other people might say, it was really mild for them or hardly even noticeable. But the data is there and it's showing that this is something that's actually inherited. These families, a huge amount of these people are dealing with, loads and loads of different chronic illnesses and symptoms. And one of the biggest one and a common one is dysautonomia. And of course, that includes POTS. And so it's really interesting. And the key to the research here is the fact that it's something that people are inheriting. And, many people, they say they're living their lives fine, they're healthy, they're active, nothing seems to be wrong with their health. And then all of a sudden it comes on overnight after a traumatic experience. So for some people, especially women, obviously, they say that, this started after I gave birth to my first child, or people say that this started after I was in a car accident or after I faced something really traumatic. I had a really bad viral illness. I just became overnight really sick and symptomatic. And so while it's true, doctors have kind of discovered that traumatic experiences and things like that kind of trigger it to kind of come out of the woodwork. It's also true that it's something that you inherited and something that you've had since birth, but maybe it didn't actually come out in full force, so it wasn't recognized. There were more subtle symptoms probably growing up that you did not associate with MCAs. So like if a child missed a lot of school because they had stomach problems, stomach aches, things like that, that could be, a sign that, yeah, you've had this your whole life, but then it took something greater to kind of trigger that or bring it out, if that makes sense. And that's what these doctors are finding a lot of the time. And so there's a specific gene abnormality, and while it's not yet well understood, it's pointing to a brighter future and a future with more answers, because if they can identify the gene and isolate it, research it extensively, then maybe they can figure out why it's happening, what can we do to fix it or prevent it. So it's actually really exciting that they've discovered that it's something inherited. And so to touch on the topic of POTS and POTS patients, actually most of POTS patients tend to have a normal tryptase blood serum level. And so they don't have mastocytosis. So the more labs and research that can be done, the better, so as to identify, what's going on in these individuals with mast cell symptoms. So there's other chemicals too, though, that are also released in the body from mast cells, and those can be released, and the levels can also be tested, like in your urine. So if you have the symptoms that fit and the patient shows that they have mast cell chemicals being released on a regular basis, then physicians are more willing to diagnose you with MCAs and move on forward to treatment. Now, treatment approaches, of course, are complex and highly individualized, and so that's probably something for an entire different video, because we could go on and on about, the treatment for MCAs. But I just kind of wanted to talk about the things that I've found in my research, and I will cite my resources down below where I found this information. I watched a great video on Dysautonomia International, symposium, if you will, about mast cell activation. And so I encourage you to kind of check that out. That's where I got a lot of my material today, and it was just really enlightening. I hope you found this video helpful and you learned something about MCAs. Please let me know your experience down below if this is something that you suffer with. Is it also something that you've found that your family members suffer with, at least to some degree? Because again, it can affect you so severely, and yet say your mother has it, just very mildly, where you wouldn't even think that she has, a high tryptase or MCAs going on. So just let me know how you're doing in the comments below. Like this video and don't forget to subscribe for more content, and I'll see you in the next video. Bye.